Welcome to Future Focus, the Next Gen OD Canada podcast, your go-to source for insights and inspiration as you navigate your optometry journey.
Whether you're a student or a recent graduate in your first few years of practice, we're here to explore the topics that matter: career paths, job opportunities, board preparation, and more.
Each month, we'll bring you expert guests and practical tips to help you thrive in the world of optometry. So, let's shape the future of optometry together on Future Focus, the Next Gen OD Canada podcast. Hello. Welcome back to the Future Focus podcast. We have a very special guest today, Dr. Audrey Li, who is a 2025 UW graduate. And she was born and raised in Ontario and now is practicing at a clinic in St. John's, BC, which is not where you're from.
No, nowhere close by. Hello, everyone.
Yeah, you moved to the opposite end of the country. Such a different experience than Ontario. I mean, the GTA has a lot to offer. Ontario has a lot to offer, but I mean, the air probably just smells way fresher in BC. I'm very jealous that you're back there right now.
Yeah, I think I wanted to practice in BC, but it's probably not the British Columbia that you're thinking. The town is called Fort St. John. A lot of people do confuse it with St. John, I believe.
I said St. John. I'm sorry.
Yeah, but it's actually called Fort St. John, and it's kind of like Alberta in the landscape. There's a lot of people part of the oil patch here. That's what they do for work.
Yeah.
There's a lot of young families here, which is kind of nice. But if you drive an hour out of town, you can get to nice mountains and you can see the water. So it's quite beautiful.
Wow.
Oh my God, you're getting the best of both worlds. I love
Yeah,
that.
I'm just so curious because I know we had a few classmates who decided, let me go work rural for a couple years, make some money and come back and explore. Was this always your intention? Did the opportunity present itself and you thought, let's try it? And are you planning on staying or how's it going?
Great questions.
Yeah.
I was not expecting this at all. I was defaulting, just gonna finding a job closer to home in the GTA and then working there long term and kind of that being my life. And then one of my classmates, my friends, she was like, hey, you should try this. And then I was like, oh, this is a great offer. So then
Let me just pack up my life and go. Check it out.
3 checked bags on an airplane.
Wow.
I didn't ship anything. And then my contract is for 2 years, but we'll see how things go. It's been going really well so far. So I don't know. I don't know what the plan is for now. We'll see.
I find that anytime I talk to ODs and I ask what made you go rural or what made you go away from home, that was always the situation where it was you never really planned to do it. And it's just somebody just texts you or messages you one day and goes, hey, would you be down to do XYZ? And then when you try it and then all of a sudden you love it and then you blink, 10 years go by and you're still there and you're like, oh my gosh, I love this.
Yeah.
And actually, I guess we're jumping to, we just got really excited about this. So the whole topic of our conversation today is for all of those students that are looking for their first job, that are just about to graduate. How should they go about choosing the right opportunities for them? And so I guess you kind of just sprinkled right into it. But when you were looking for your first job, Audrey, right when you were ready to graduate, what were the biggest factors or the biggest things you were looking for in that right opportunity? And then what was the factor that mattered the most to you in the end to make the decision that you just did?
Yeah, so I think the job hunt started in February for me. From Ontario, there was that job fair that happened in downtown Toronto where they had a bunch of clinics come in and there was only one small table of new grads and a lot of potential hires. One doctor said you should look for work where you want to live. So initially I was like, yeah, of course I want to live close to home. I'll live at home so I don't have to pay for rent. And it's where my family and my friends are. So I was looking at all the clinics in the area. I made a table listing their name, the pros and cons, and then I decided which ones that I wanted to send an email out to. So I did a lot of interviews virtually and in-person visits to kind of see if we were looking for the same thing. And then I made a priority list. So how long the commute time would be, what areas of interest that they're kind of specialty in. So personally, I like myopia control and dry eye. So I wanted to see if they kind of had the same areas or equipment. Equipment is important to me too. So when I went for the in-person visits, I wanted to see if everything was working well or if it was super old. Or maybe a little crooked or things like that. The staff, like how many staff per doctor there usually is. If they have paper files or they're more of the electronic medical record system, which I would prefer. And even things like the way the space is built or the aesthetic per se. I like a more modern appearance of things. That was not that important.
And those are like the extra cherries on top, right? If you find a place that you love working and then it looks brand new, it's like a little breath of fresh air. It's like, oh.
Yeah, especially if you're in that space for your entire day. Obviously, the pay was pretty something I was looking at, whether there was a minimum guarantee or not. And then like how long each eye exam was scheduled for. I know this is a really long list.
No, it's actually a great, very thorough list that I think everyone's probably like jotting down notes right now.
Oh, excellent.
It's perfect. Yeah.
Yeah. A lot of clinics in the GTA actually did not offer a minimum guarantee, which was something I was a little bit scared of because I think one big fear, you come out of school and you're like, will I make enough money? Will I see enough people? I have debt to pay. So that's a big factor. So it was actually really hard in the GTA to find a full-time job where you can work 5 days a week. Typically 5 days a week, I think most people want to look for. I think most clinics were looking for maybe 2 days a week. So then I would have had to combine working at maybe 2 or 3 different clinics and also give up my weekends. So then I was pretty upset with that. I think there's pros and cons for both. The pros, you could try out different demographics, different groups of people, work with different people and see which clinic flow you like more. But then when you're working at different places, I think in the beginning it's hard to learn how every clinic would work. And then maybe the follow-ups would be hard to schedule too, because you're not going to be there maybe for your next day uveitis follow-up.
Yeah.
So then I was like, well, I'm going to start searching further away from the city because maybe I'll find a full-time job because I really wanted to just be at one clinic, I think, at the end of the day. And if I were to search further away, I would probably have to move out of my home or drive over an hour. So that's when my friend was like, if you're planning on going far away, maybe you should move to BC because I'm in BC.
Was she already practicing at the clinic?
Oh, no. We're in the same class. So she was already.
Oh, okay. So she was applying for that position.
Actually, a different position, but one of the colleagues that I have right now is also my classmate. So it kind of yes and no.
So there's a few of you.
She just found out about the position hiring because the other classmate decided to sign.
Got it.
So then we're like, oh, where's everyone working? So that's kind of, I don't even know if I answered that question. When I was looking,
you did. You answered like the next question. No, there's like, first of all, can I just say every single thing that you just talked about the way that you find job opportunities in the GTA, from what you're saying, if you graduated in 2025, has not changed from when I was looking for a job in 2020. So 5 years back, especially like during COVID times too, and with everything, I had the exact same experience, right? It was no one in the GTA offered a full-time position. A lot of them were looking for part-time, fill a day here, fill 2 days here. I worked 7 days a week at 4 different clinics, like for a whole year, because it was just like, every day that you're not working, it's like, well, maybe I can find another clinic that just needs a fill-in, right? And it's like a short day, it's a half day. And then you just kind of start puzzling in all these different places. And the advantage is you start to learn different ways to practice, different practice modalities, but you're learning that kind of over time and with like trial and error.
Yeah.
And yes, follow-ups were hard to book. having that consistency with your patients was a little bit tougher. So it's very interesting to hear everything you're saying. I'm like getting a flashback. Like this was exactly my life 5 years back, and it clearly hasn't changed.
And I still work Saturdays, so.
I still work Saturdays too, girl.
That's terrible.
I know, and everyone in a rural area is like, I work Monday to Friday. I love all my weekends off. And I'm like, ugh, I hate you guys.
Everything is closed on the weekends.
Yeah, everyone's enjoying their life. And you're right. I mean, I find that actually, I was also at one point debating, should I be looking for something outside of the GTA? But it's funny that in my head, because we're all from Ontario, that I would still never think to move like very far away. I would think to commute, because that's the mentality of, people who live in the GTA is to drive and commute, an hour and a half, maybe 2 hours.
Yeah.
And even then, I would have never thought to look for a rural opportunity just out of the province. Then I would just assume, I'll look for a rural opportunity in Ontario.
Yeah.
So kudos to you for, having the courage to look for a whole new province when you were so ready to stay with family and be close to your friends.
Yeah, I was looking at the rural Ontario too.
Yeah.
But then when I was comparing Ontario versus British Columbia billing-wise, British Columbia has balanced billing.
Yeah.
So it makes things more rewarding for the same thing that you're doing. Yeah. So that was definitely a push in the BC direction.
Yeah.
As far as like working in a rural community, I'm assuming access to care is a little bit limited. Do you feel like you're managing more disease because there maybe isn't as much access to ophthalmology?
100%. Yeah, that's part of the reason why I did come. The learning is so much better, especially since I'm like a new grad. I felt like big exposure would be helpful for fast learning, especially since I didn't go with a residency option. So I'm definitely seeing a lot more disease and managing more. So we don't really have specialists here at all. There's no ophthalmology clinic. There's a visiting doctor that will come maybe 2 days in a month from Vancouver. They will fly in and then work out of the hospital to do cataract surgeries or do injections for AMD. But they're really fully booked because there's a lot of people that need the care. So the things that we can do, we try to do as much of it as possible, but it makes it really hard actually for things that aren't really getting better. We're like, oh, I wish there was someone we can give this case to and not have them come every day in our chair. But it's helpful for the patient because then they don't have to wait a long time or fly. I think the on-call ophthalmology is 5 hours away drive in Prince George. And then if they want to go to Vancouver, they'll have to fly there. Definitely a lot more managing disease. Yeah.
I'm just going to ask a question that's off topic from that conversation, but because you mentioned, the lack of accessibility to ophthalmology, which a lot of rural areas all across the country have issues with and challenges with, if students are paying attention right now, just in the political state of optometry, we're trying our best as a national association to try and maximize our scope of practice, not just expand, but to maximize what we can do and what we're trained to do. So what type of support do you feel you guys have in the area you practice in terms of, optometry having more access to do like minor procedures, minor laser procedures, things like that to try and help your patients when ophthalmology is just not there and not available at that time?
Yeah, the associations are definitely pushing for that. I think in the last month, they were asking people to send emails to an email address that would explain their scenario and how it would be beneficial for optometrists to do certain things like prescribe. Oh, BC is the only province that actually can't prescribe orals. So they would have to go to the emergency room and wait there for 5 hours to get a medication that we could have given, like amoxicillin, for example. Or they would go to their family doctor who doesn't have an availability to see them either. So
I didn't know that. That's wild.
Things like SLT, so it's for glaucoma to lower eye pressure. They would probably have to wait between 1 to 2 years to get that done. So it does suck, but Oh, not SLT. I'm thinking of LPI too.
Yeah.
LPI is something like the little laser that's pretty simple, I think. And we were taught that in school too. In the most recent years, at least, we've been doing that course, advanced procedures course. So it's something that we learned, we know we can do, and it would really make it easier for patients if they can get that immediately rather than wait.
Do you feel that you get support, though, from the local ophthalmologists that work with you guys?
No.
Okay, so nothing's changed, BC, Ontario, kind of the same.
Yeah.
But it's okay. We're hopeful. We're still going to educate. We'll get back on topic. I was just very curious of like, is the temperature a little bit different in BC versus Ontario?
Yeah, it's colder up here in the winter.
Yeah.
Are the doctors you work with, not your classmate, the other doctors who have been there longer, or the owners, I guess, have they been good mentors for you?
Oh, yeah, extremely good. They're very, very helpful. I bug them at least once a day, I would say, even still. Yeah, extremely kind, helpful. They have all been there for 7 years.
Oh, wow.
How many owners are there of the clinic?
There's one owner, and then the 2 associates have been there for 7 years, and then myself and my classmate have joined recently.
Okay.
Yeah, the owner is semi-retired, I would say. He's in there sometimes. He would cover when we can't go in. Yeah, but there's 4 lanes that can operate at the same time.
Wow.
In terms of choosing the right opportunity for any students that are listening, like that's a big one too, is when you're interviewing places, knowing, are you going to be working solo on those days that you're there, or are you going to be working alongside other ODs? I know personally when I started, I chose clinics where I was going to work with other ODs on the same shift. Because, graduating, my confidence level was not that high. So I was also nervous to practice by myself. And I didn't want to be in the clinic alone if I had any questions. So that's a big point that I'll add as well. Yeah. And did you feel like that was one of the reasons why you also wanted to choose this certain location in BC? Because it was, you'd be working with other docs that have experience and like can help you out?
Exactly. Yeah. I don't see myself being alone in a clinic right from the get-go. I thought about it. There were opportunities like that. But at the end of the day, I was like, I don't think I can handle it, even if they were on the phone and they can help me out remotely.
Yeah.
In the beginning, it felt more comfortable if I had some support. But there are some people that can do it and they're really confident.
I did it and I wasn't confident, but I just did it.
Well, I feel like in general, the nice thing is, like, I know we're all going to be nervous to do that when we graduate. But I mean, looking back, I think when you practice day in, day out, most of the time you're doing routine eye exams.
Yeah.
I mean, the more healthy people you see, I think you're going to gain your confidence typically within a month or two. Like after a month or two, you're already kind of like getting in the flow of a routine eye exam that you're probably thinking like, okay, if I'm alone for a day, like I won't explode, like I'll be fine.
Right.
Yeah.
Or it's like you can text a friend or like text a colleague. Like
definitely stay in those group chats that you're in school. Yeah. I still have my core friend group and we message and talk about patients all the time.
Yeah. It's so funny. I like remember those days. Like I don't really do that anymore, like unless it's like a really one-off weird case. But like at the beginning, like I had active group chats, like we were chatting all the time.
I did too.
Yeah.
I think that's a really helpful thing to have.
No, yeah, it's amazing. Now I'm like, I don't want to talk about optometry outside of No, I will ask opinions of different colleagues now. And it's nice to chat, but I think it's nice to be in an environment too where you can chat with someone like then and there in person, or have someone come in the room and confirm what you're seeing.
Yeah.
Right. Oh yeah, I did that on my first day. I had one of the doctors come in because I was like, I'm not used to finishing an eye exam without someone taking a look at my work.
Yeah.
Can you please come in? But after that, everything was just me. And then I would describe it to them rather than them having to come in the room.
Yeah.
Yes. And then Audrey, we're just going to continue on a little bit with, for students that are kind of prepping for their job interviews, prepping for what things they should ask when looking for a job. So now that you think back to all the positions that you applied for and the different types of jobs you were looking at, what do you think every student or new grad should be asking during a job interview before accepting a position, even if it seems like it's the best position ever? What should they be really focusing on?
They should ask anything that they can think of. I would say the scheduling, what to expect, how many patients that you might expect to see in your schedule when you sign. Is it going to be full, or do they expect you to kind of build up on your own schedule? There were some clinics in the GTA that were asking me, they're like, what will you do to kind of create your patient base? Like reaching out to the local old age centers or going to family doctors and saying, hey, I'm the new optometrist in the area. And I was like, okay, yeah, that's fine. But for my clinic, they were saying you can expect a full schedule right when you start. Like,
Amrit, I'm just curious. Sorry to interrupt. Like, what's your opinion on that? Because I feel like it's the owner's role.
Oh, definitely. I'm an owner. So I guess I'm not a new owner. My practice is almost 3 years now, but like I've been an associate, I've been an owner, and I don't know. I think my mindset is still always associate oriented because I've been an associate for longer, and I've been an associate at different types of practices, right? So I experienced the corporate side. So the corporate side was definitely, hey, we need someone. We already have lots of patients. So when you come in, you'll get a lot of patients and a lot of walk-ins. So your job really was to sit there and just wait for people to come in. So that was my corporate experience. So there was no pressure for me to build the practice, right? At a private practice I was at, there was no minimum guarantee. It was a percentage base, and it was, we have a lot of patients, but we're an old practice where every patient kind of stays with their existing doctor. So yeah, when you start, you're going to have almost zero patients. You're going to have to just kind of build it up. However, I was never asked or pressured to go out and promote myself. It was still like, we're a busy practice. We're always getting new patients. So when a new patient comes in, they'll be with Dr. Bilkhu. And so it was still, patients were kind of given to me slowly over time. And then, that just built up. So now that we were kind of looking for an associate to hire, and we can't now. So that's unfortunate because I ain't got no money. But when we were looking for an associate, I mean, we also did not pressure the associate to say, you have to go out and find patients. I mean, it's my business. It's my job. I have to be the one marketing and, paying for ads or doing social media. Now, if they want to join in, I added that in my ad for the job board. I put a little like fun thing at the end, like, by the way, we do TikTok videos, so you're not going to get paid, but we would love if you would join in on the TikTok videos. You know what I mean? But I don't think as an owner, you should ever be putting that pressure on the associate, because at the end of the day, the associate will never care about your practice like you do.
You're never owning the patients as an associate.
Yeah. Yeah. You don't own the patients. You don't own the files. You're not going to go home with the files if you leave my clinic. They're my patients, right? So why would I ever put that pressure on you? And I think for any student out there, really try to feel that, vibe when you get interviewed by owners. If the owner is really trying to like spin it on you in a nice way, to be like, oh, like, we'd love if like you're motivated to help grow our practice, get out there and spin those like boards, on the road saying, come visit our clinic. That's not your job. You're an independent contractor, meaning you come in, you do your job on the patients that are booked, and then you get out. Now, you can do more. You can go above and beyond, but that's not part of your role as an optometrist, as an associate doctor. They would love it if you go above and beyond, and then maybe they'll compensate you more and praise you more, but that should not be something that's required of you in a job as an associate doc. My personal opinion.
Agreed.
I do talk a lot. I go on rants a lot.
I think that's actually important to say, because I think coming out as a new grad, there is a lot of pressure. And I think a lot of owners would disagree with what you just said.
Yes.
And might put pressure on new grads to go and market themselves.
Mm-hmm.
You know, if a new grad wants to and wants to get on social media and do that, then great, like let them, and that's wonderful.
Yeah.
But I don't think it should be an ask.
Yeah. I think the only time as a new grad when you're applying for a job, the only time I think you should be expected to go out and venture out and try to get patients for the clinic is if you're offering the clinic to like bring in a specialty. So like Audrey, like you love dry eye. If there was a clinic that you really wanted to work at because the location was beautiful and awesome and you wanted to bring in, IPL, Zest, radio frequency, any of that stuff.
Yeah.
Then you would be the one to say, I will go out there and bring those patients to you so that it's worth bringing in these devices.
Yeah.
That is definitely, a different scenario where you're going to have to put yourself out there more for the practice, even though still at the end of the day, if you ever leave that practice, that IPL is not yours. That radio frequency is not yours. You're not going to go home with it. And those patients are still not yours.
Yeah.
You're going to stay. But, the benefit is you get to finally practice cool stuff that you want to work with. So why not? But outside of that, no.
Audrey, I'm curious, what has been the biggest surprise? How many months has it been? September, October, November? You start practicing in September.
Yeah, I started in September.
Okay, so a few months or more than a few months. What has been the biggest adjustment going from being a student to a real doctor?
100% is the responsibility. Like I mentioned earlier, we had a supervisor check everything that we did. One of the clerkships I had, I wasn't even responsible to write down the prescription or finalize the prescription. They were the ones that did it. So I didn't even have to worry about that part of things. Like I would put down what I would do and then it would get changed. So just not having someone double check my work and making the final decision and sitting with that responsibility, I think was the biggest adjustment. It wasn't a surprise, but it was a huge adjustment. And also, I would say the eye exams we did in school were 2 hours long and now they're 30 minutes. So it's different. Like you just do the tests that are needed for problem solving, which is kind of nice.
Yes.
Very nice.
Were you guys, sorry, I'm from ICO. So in Waterloo, do you guys do 2-hour eye exams in your third year?
Yeah.
Wow.
But not in fourth year.
Fourth year is a bit shorter.
Well, in fourth year, you're at externship sites. So that's already a big jump, right? Because then if you're at a private practice or corporate setting, like, yeah, you're really automatically being cut down into like 20, 30-minute exams right away. And then in Waterloo as well, in the clinic in fourth year, you're expected to do.
So you come back, I think you do 2 hours, right?
I don't remember it being every 30 minutes, but it was shorter than 2 hours.
Maybe it was like 45 minutes.
Something like that. I've already forgotten.
Wow. ICO really trains us to be robots. It's so great. In a good way. Not robots. They drill us like the military almost. So I feel like in our third year, I feel like they already pressure us to like make sure we get everything done within like 30 minutes to 45.
Wow.
And then in fourth year, it's like 20 minutes in, they're knocking on your door like, what's going on?
Oh, wow.
I'm probably over exaggerating, but yeah, that is a big transition for you guys. Like that's a big jump in time.
Mm-hmm.
Yeah, that is big. Yeah, see, you'll get through it.
I think like for me, one of the hardest things in first year out was learning how to prescribe, because I think like it's such an art and I'm still learning. And I just like remember like my first recheck and I was like, what do you mean? They don't like get this in like, but that's something you learn, and not to prescribe too much still. And
Yes. Actually, in the clerkship that I said the doctor finalized every prescription, it was also learning, because he would be like, this is the way that I would change a prescription because I don't get many rechecks. So it was also a learning experience too.
That's really useful.
It was very useful. Yeah, rechecks happen, unfortunately.
They do.
But sometimes it's not your fault.
It's true.
Oh, we could do a whole episode on rechecks.
I'd love to do that.
It's not always the doctor's fault. It's not always your fault. There's so many different variables to like frames, lenses, what patients are wearing them for.
Working distance.
Mm-hmm.
And then Audrey, we'll wrap this up just for, kind of a final thoughts on how to figure out like what the best environment is, when you're looking for a job. So what would be your final advice for students that are applying to jobs who want to figure out what sort of practice mode or practice environment is good for them? Because, for example, when you were applying in the GTA, I'm sure you weren't looking at rural practices that were going to be disease heavy. It was probably going to be refraction and primary care heavy.
Yeah.
And now you just totally 180'd and now you're doing a lot of disease. So what advice would you give other students to be kids? Why did I say kids? I'm thinking of like school. Sorry guys, I work in pediatrics all day. So anyone who's in school is a kid. What advice would you give to those students to really figure out what practice environment would be good for them?
Yeah, definitely visiting the clinic that you're interested in, meeting the staff, the doctors, and if you even wanted to sit around and shadow for a little bit to see what it's like and how the other doctors are kind of speaking to the patients and what tests are being done. But at the end of the day, you never know until you try it. So it may not be the job that you're signing for the rest of your career, and that's totally okay. Your first job isn't forever. I know some people in the class above me that have already switched jobs. So they practiced for a year and they said, that's not for me. Different priorities or the team dynamics didn't work well for them. And that's totally okay. You can switch to something and then see if you like that one maybe a little bit more. So there's not really much pressure. I think it's okay if you switch and then go with what your interests are. So if you prefer primary care, maybe do that. Or if you like something else, like a specialty and you want to get better at it, maybe find a clinic that does that more often. I think overall that's about it.
That's like perfect advice.
Oh, thanks.
And just to complement that, there is no stress to picking out a job because yes, you can get out of it anytime. You can always switch and do something else. So to end that off, look at your contracts and make sure there's an exit strategy.
Yeah.
Right?
Yeah.
Just make sure you know what your exit strategy is because you're so right. Your first job is never going to be your forever job. And so as long as you know that there's a way out, then there's no pressure to try something and just see how it goes, see how you like it.
Yeah, my clinic and I know other clinics have also offered you can just try working there for a month before you officially sign the contract too. So that can always be an option.
That's nice.
Yeah. Wow. Thank you so much, Audrey. Thanks for taking the time to share your journey and your experience with us. I find it so interesting that you just went all the way into Fort St. John, BC.
Yeah.
And I'm so glad that you're loving it right now.
Yeah, it's great.
Yeah. And then lucky you can enjoy all the hikes and the fresh air and the mountains and
I'm looking forward to summer. Winter was like -40, -50, so it wasn't the most fun.
Oh, gosh.
And it is very dry here, but the summer is coming up, so I'm excited.
Yeah, it's going to be
There's still snow on the ground here.
And then is there any contact info that you want to share just in case if other students listening or other new grads listening have any questions for you? Since you do work in a rural practice, I'm sure people are going to be very intrigued to hear more from you and ask you questions.
Oh, okay. I did start an Instagram account because I thought I was going to post on it. So I think maybe that would be a good source. It's actually just Optom Audrey. So OPTOMAUDREY. I think it's public, but you can try messaging me if you have any questions.
Perfect. Well, okay. In the summer, when you do all your hikes, you're definitely going to have to post those. And then that's going to convince other ODs to move there and start practicing there.
Yeah.
Thanks for tuning in to this episode of Future Focus, the Next Gen OD Canada podcast.
You can find us on all major podcast platforms, including Apple Podcasts, Spotify, and Google Podcasts. For episode summaries and more resources, visit us at icarebusiness.ca.
Be sure to follow Next Gen OD on Instagram, Facebook, and LinkedIn for updates, news, and more insights into the world of optometry. Don't forget to check out the show notes at icarebusiness.ca. Until next time, stay focused on your future.